Chedana Lekhana group of medicines has to be continued. Then Shodhana and Rasayana. Most probably in the cases, most of the cases, you may have to continue this Rasayana therapy for a period of 2 to 3 months. The medicines I prefer to use here is nothing but Swayamagni Sindhuram. The medicines which I have been explained till now will be quite familiar to you, and sometimes the capsule that is Swayamagni Sindhuram will be an unfamiliar one, but it is very effective medicine in the case of hypothyroidism. This Swayamagni Sindhuram, the basic reference of this Swayamagni Sindhuram is in Shargadhara Samhita, Bhasma Prakarana, and it is in the name of Swayamagni Rasam. And the same medicine, with a little bit difference in the Bhavana Dravyas, is explained in Sahasra Yoga as Swayam Bhasma. The indication of Swayam Bhasma in Sahasra Yoga is nothing but Amravittam and what we say the Parinama Shulam, etc. And in the Shargadhara Samhita, it is explained in the context of Kshayaja Kasa. So the ingredients I will explain later. But this capsule, it's available in capsule, and this Swayamagni Sindhuram is the best medicines as far as my observations in the case of severe marked hyperthyroidism. But at the same time, better not to start in the other two cases, in the what we say in the subclinical hypothyroidism and the other hypothyroidism without hormone replacement. Better not to start these medicines, because this is not, we cannot say that this medicine is 100% safe because it doesn't undergo what we say for a puta. The method of preparation is nothing but the parada gandhaga will be ground together and formed to kajali, and along with to that kajali loha basma will be added, and this again will be ground together with the kumari swarasa. And that paste is kept under in a tamra pot, in a copper vessel, and kept in the sunlight. And once we kept for a period of in the severe strong sunlight for a period of 6 hours or for 4 to 6 hours, it automatically starts fuming. It starts fumigation, and almost later the fumes will be continued, and for a period of 2 to 3 hours. Then the fumes get subside by itself, and we collect the medicines. And the same procedure is repeated with a different Bhavana Dravya. So that's why that becomes without this medicine, in the preparation of this medicine, there is no Agni Sanigarsha. And the main thing what we do is nothing but Surya Puta. And that's why it is called as Swayam Agni. And that is nothing but it's a self-generated Agni only. And thereby, because of the lack of puta or putipakwa method or any other parpadi method, we cannot say that this is 100% safe, and we are not supposed to continue this for a period of longer duration. And so, better my opinion, if other the normal medicines are not responding, then you go for this Swayamagni Sindhuram. The group of herbal drugs will be again this Varanadi or Arthavilyam, and definitely the Skanjanara Guru can be added. The same application, that is Shodhita Tankana and Rasmati Churna with the Jambira Swarasam, can be applied over this area. This is the before and after. It takes around 3 to 6 months to come to the normalcy. So what are we face so many confusions by when we deal with this type of cases, isn't it? So TFT will be normal. Their symptoms will be persisting. So how to tackle? Most cases, by consuming 1 or 2 months of levothyroxine supplement, his or her thyroid level come to the normal. But the symptoms presented by her will be continuing without any change, whatever it may be. It may be hair fall, it may be obesity, it may be menstrual irregularity, whatever it may be. Her symptoms will be presenting at least up to some extent, but her TFT will be normal. So the physician who treat the modern physician who treat her doesn't have nothing to do with these conditions, and then they come to us and they ask whether can we start Ayurvedic medicine. There we face a dilemma that whether to stop their medicine or whether to continue their medicine, and can we start our medicines along with their medicine. If we are starting, how much time duration we have to give in between both medicine, or if we decided to stop their medicine, then how to stop that medicine, when to increase if we stop the medicine suddenly. So these are the main dilemma faced by each and every physician, because these were the main issues which are faced by me when I started treating thyroid disease. So we will decide, like we will discuss by the case wise. Another case, male age 45 years, complaints of slurring speech, marked dyspnea, palpitation, and severe lethargy. He was also a marked hypothyroid, and he was also on thyroid replacement therapy, that is on levothyroxine. But one fine morning, he stopped himself, and that day he thought that, okay, I am stopping these medicines. I don't need anything, and because I have been taking this since a long time, since 3 to 4 years or since 10 years, I have been taking this medicine, and still absolutely no change with my symptoms. Then why should I take this medicine? This will be his thought. And one sudden morning, he will stop that medicine, and he come to us. How do we approach this case? On examination, there will be small nodule on anterior compartment of the neck. It's not visible that much. Definitely, that we have to go for thyroid function test. On examination, you can see that his thyroid level has been went up to 100, more than 100. They couldn't elicit how much it has been gone. They have been rechecked again, still that result is the same. Definitely, if such a result comes to us, we have to analyze the entire blood picture. We send for the further detailed evaluation. His renal parameters were normal, fasting blood sugar, PPBS, everything normal. But when we come to the lipid profile, his total cholesterol was 521, triglyceride was 167, and LDL is 467. It's been increased this much, and it's quite risky to deal this case in this stage. But there is a positive thing that he already stopped his replacement therapy by himself. So we don't need to forcefully stop that medicine. That's a positive sign for us. And how such a situation comes, how do we manage? Again, absolutely there is no change with that. We have to go for Dibana Bhajana, Kapahara, along with Vadanulomana, and not only if needed, Shodhana is compulsory in this type of case. Here also, the main medicine I prefer is nothing but Swayamukti Sinduram, 200 milligram with honey. Along with that, Rasonadi Kashayam. And why Rasonadi Kashayam? No, why not Varanadi? Rasonadi is more intended, has got more action on Vyanavada. Because the indication you can see, Rasona Karavi Krishna, Hirabhisnadhidam Janam, Pida Unmargajam Vadam, which is the Unmargaja Vadam. Either the Unmargaja Vada is nothing but either Udanavada or Vyanavada. Urathanam Udanasya Nasa Nabi Galam Charya. See his complaints. Vak Pravarti Prayatna Urja Bala Varna Smriti Kriya. Vak Pravarti, slurring of speech has been affected. Marked dyspnea, Vak Pravarti Prayatna Urja, lethargy has been generated. Urja Smriti Bala Varna Smriti Kriya. And when we come to the Vyano Hridisthina Krishna Dehajari Mahajava Gadi Prasarana Agunjana Nimesha Unmesha Trimbha Anna Swadana Sweda Asrak Sravana Dikriya. So everything, especially the lethargy, what we say anorexia, then dyspnea, etc., are related with either Vyanavada or with Udanavada. So Varanadi has, again, as I explained in the Panchakola Churna, this Varanadi can be given in the Ama, which has been associated with the Dhadugata. If the Ama is if he is suffering from Sama Dhadu, or if the Ama is situated in the Koshta or Sama Koshta, then the best option will be Varanadi. But in case of deranged Vata, I prefer to go for Rasonadi. See the ingredients. Stira. Stira is nothing but a Hridya drug. The stay fire Stirasikdham is explained in the context of Vada Vyadi. In the Hridgada Vada, the best medicine is nothing but Stira Kshiravaga. So Rasonadi is also containing Stira. That is Rasona, Karavi. Karavi is nothing but Krishna Jiraga. then Krishna is nothing but Pipli and Sthira. It's a wiseful combination, that is Rasona Karavi Krishna Sthirami Sadhidam Jalam. And then Uguru Panchavalam Churnam, that is Toktudi Kakshayudam Madhulidam. Kushta Bhagandara Gulma Gadikna. That Gadi, even though it is considered as Nadi Prana, it has got a high amount of Chedana Lekana action. Along with Swayambhakti Sinduram, we may add Annapeti Sinduram with Nimbu Swarata as the condition is this much increased. Within a span of 1 month, the serum TSH from 100 it came to 80, and from this cholesterol it came from this 520 it came to 310, and LDL it came to 250. From this 360 it came to 250, and again from 80 it's been reduced to 50, and the other conditions also has been reduced considerably. Within a period of 3 to 6 months, the hormonal levels came to the normalcy, and at the same time, the symptoms of the patient also came to the normal. Once the hormonal parameter, lab parameters, as well as his symptoms came to the normalcy, then we can start tapering the medicines gradually, stage by stage. The first method is to stop gradually the Swayambhakti Sindura, and then reduce the dose of Swayambhakti Sindura to half, then to reduce to 1/4, and then to reduce to 1 from what we say twice daily to reduce once daily, and like that the other medicines also the same time simultaneously you can reduce the other medicine. Within a span of 2 to 3 months, you can reduce the dose of you can stop our medicines also. So what could be the the mode of action? As per my opinion, you never prescribe a medicine if you don't know the pharmacodynamics of that medicine. You should be able to explain the pharmacodynamics either through Ayurvedic parameters or through modern parameters. If you are not supposed to explain the parameters, how the medicine acted in your body, that you are not supposed to write. That's the principle which I follow, and usually this is the thyroid circulating pathway, and from the plasma iodine, the iodide oxidation happens. From this iodide oxidation, with the help of thyroid stimulating hormone T3, T4, and T3 started secreting, and the T3 and T4 will be released into the blood, the circulating blood, and from the circulating blood again that reached by the help of TSH, that the deiodinization of that hormone happens, and because of the deiodinization, again the free and released iodine reached to the free iodine reached to the plasma, combines as plasma iodide, and the circle becomes repeated. So our medicine act as, especially this Swayambhakti Sinduram or Annapeti Sinduram or what we say Loha Bhasmam, etc., act as a converter of this plasma iodide to iodide oxidation. That stimulates the second stage, that is from the plasma iodide, that stimulates the procedure of iodide oxidation. This is not by my words, and the same pathway is being explained as the Satoshkar textbook of pharmacology. So elements that influence, as I think I have explained this in the previous slides, that is iron, zinc, and copper, iodine and selenium. We can supplement this iron, zinc, and copper with our medicine. Iron is nothing but Kasisa, Annapeti or Swarnamakshika, and there are so many Loha, Kanta, there are so many options, even Mandura, there are so many options. And in place of zinc, we can substitute with the Yashadabhasma. In place of copper, you can use either Tamrabhasma or Hridayanavaraksa, or there are so many other Tamra containing medicines also. So, I had explained some of the dilemma previously. Now, let us go to the solution. What we do in this condition, the dilemma. If TFT is normal, symptoms persisting, what I follow is just treat according to the symptoms. Don't worry about the TFT. What we say, better not to recheck in between. And once in 3 months or once in 6 months, you can have a thyroid function test. And if it comes normal, you just treat as symptomatically. Whatever symptoms he or she present, you just treat according to the symptoms. To stop HRT or not, hormone replacement therapy, how to stop or not. depending on the condition. That you can stop the medicine. Definitely, you can stop the levothyroxine without any complication. But the main thing, he should be. What are the other the conditions, comorbidities? He should better. He should be if he is in not using any, or if he doesn't uh, possess any of the comorbidities such as high diabetes or dyslipidemia or hypertension, etc. In such cases, better not to stop the hormone replacement therapy. If you decided to reduce, or if you decided to stop the hormone replacement therapy, how to withdraw? That is also a main problem. Whether to taper the dose, or whether if we are decided to taper, how much we can taper, or how much micrograms we can taper, or can we stop it suddenly? These are the other dilemma. As per my observations and as per the modern researchers, if you decided to stop the hormone replacement therapy, better to stop suddenly, and don't try to taper the medicines. You may have some previous, some different. You might have got some different opinion from the previous classes, but I do is just if I had to stop the hormone replacement therapy, if the conditions favors, I stop suddenly, because there are few researchers in the modern field that has been carried out after 2010 or 2015. Such researchers reveal that there is no change if you stop the medicine suddenly, or if you and you don't get any of the benefit, or if you decided to stop by gradually. Because if you start, then how, when, which substitute? As I mentioned, judicial combination of herbal and hormonal drugs. So there is one another problem if you decided to stop by tapering, because the hormonal half-life, that half-life of this levothyroxine, you might have been aware of half-life. Half-life is the time period to eliminate the half amount of the hormones or the tablet which we have consumed from the body. That means it is the half-life of this levothyroxine is 7 to 14 days. I will explain a little more. So, if a person is undergoing 100 micrograms of levothyroxine since so many years, it takes 14 days. It's take an average of 10 days. That is from his blood, 100 microgram. It takes 10 days to reach to. Once we stop, it takes 10 days to come to the 50 microgram. It takes again 10 days to come to 25 microgram. It takes again 10 days to come to 12.5 micrograms. So the condition go on. So if you need to get a thyroid levothyroxine free blood, at least it take a period of 3 to 6 months. Up to that time, the action of levothyroxine, which he has been already been consumed, will be there in the body, will be there in his body. So the medicine action, our medicine, the action of our medicines, we cannot judge properly, we cannot evaluate properly, and rather than we cannot, there may be some interaction with these medicines also. So always, if I follow, if the other conditions are favorable, that is no comorbidities are associated, if the patient strength, the patient rogi bala is favorable, better stop the medicine in the one fine morning. This is the method which I follow. These are some of the researches which in this field. It's been published in the field of in the Journal of European Endocrinology in the year of 2013. That is short-term withdrawal of levothyroxine induced increase of thyroid stimulating hormone and increased ratio triiodothyroid, that is T3 and T4. And the result obtained is there is no much changes if you stop gradually or if you stop suddenly. This was their conclusion. Now, we might have came across that thyroid cannot be correlated with the exact Ayurvedic term. Some of them correlated as Amavata, some of them correlated as Kaphamedo Vruddhi, some of them correlate as Galaganda or Gandamala, some of them correlate as Pandu, etc. But I feel always, in the most of the patient, there may be some difference by patient to patient. Almost, I feel it's better to correlate with the conditions of Pandu. That is almost all that condition favors in this correlation, that is Shishira Dveshi, Annadvik, Shunakshi Kuda Sadhana, Hridaya Drava, Slatendriya. Moreover, that Rasakshaya Lakshanas are also almost almost similar to the thyroid dysfunction, especially with the hypothyroidism. Now, let's go to hyperthyroidism. FT4 will be the diagnostic criteria, hyperthyroidism. Then, if it is elevated, hope you will be aware of these conditions, the diagnostic criteria, etc. So, we will go to the cases directly. What could be this? This is a thyroid presentation. Anyone? Any idea? You can just put the queries in the answers in the chat box. Yeah, it is a tibial patch, but exactly. Can anyone? There is an exact term for this. Okay, welcome. This was the patient case. Female, 40 years, presented with a reddish discoloration, hyperpigmented patch on anterior surface of tibial area with a waxy appearance. Duration is 2 months. Mild itching with a burning sensation. What could be the condition? Or how to approach this case? Is there any relation with the thyroid hormone? The suspected diagnosis is nothing. It is known as pretibial myxedema. That is, it's a typical cutaneous manifestation of hyperthyroidism. This is a condition. The presentation of the patient will be simply the skin lesion. But you should be aware of this condition. The underlying cause can be a hyperthyroidism, and this stage you are supposed to send for the thyroid analysis. Patient needs much specific treatment as that for this myxedema that gets controlled by the correction with the hypothyroidism. And the next stage. Female aged 50 years, complaints of frequent mood swings, episodes of hyperactivity associated with excessive heat intolerance, excessive appetite. On examination, severe exophthalmos. You can see the abnormally protruded eyeball. What could be the diagnosis? Definitely, the next stage is nothing but the thyroid analysis. On analysis, the thyroid level comes as 15.17. The diagnosis is elevated T4. That is nothing but a simple diagnosis, that is hyperthyroidism. What could be the protocol? It is nothing but Pitta, Vada, Rekta Shamanam, Chida Viryam, and Stambhanam. Because the main pathology happen here is abnormal metabolism, increased metabolism, and there we need to do the proper Stambhana therapy with the Chida Virya, along with that Vada, Pitta, Rekta Shamana drugs that you have to incorporate here. Among these bhasmas, I would prefer to follow this Pravala Bhasmam, Kamaduga Rasam, Lagusudha Shekhar Rasam, and Shankha Bhasmam. Water, the Anupanas can be either water or milk or milk. Again, milk or water. 100 to 200 milligram, 1 to 2 tablet, and 200 to 250 to 500 milligram Shankha Bhasmam. Also, up to that you can select. You can select the medicines as per the symptoms presented by the patient. That I will explain this later. If the Pravala Bhasma or Kamaduga Rasa, Kamaduga Rasa and Lagusudha Shekhar Rasa are almost similar in action, and Pravala Bhasma and Shankha Bhasma are also almost similar. So Pravala Bhasma is more Pitta Shamana than Shankha Bhasma, and Kamaduga Rasa is more Pitta Shamana than Lagusudha Shekhar Rasa. In this case, I prefer to go for Shadangam Kashayam, that is Dhanachandana Shundembu, Parpado Shira Sadhinam, Shidam Tepyo, Idam Toyam, Padanam Trujvarabham, along with the Pravala Bhasmam, 100 milligram with the water. Avipatti Churnam 5 gram HS. After 4 weeks, her Paitika symptoms has been reduced little or almost came to the normalcy. Then the Shadangam has replaced with the Kalyanakam Kashayam. It took around 1 month to come from 15, it reached to 6.17 and the symptoms are also came down. So what could be the mode of action in this hyperthyroidism? Again, this is what I prefer. If you are not aware of this pharmacodynamics of any of the medicines, either you should be able to explain through Ayurvedic terms or through modern terms. You are not supposed to prescribe that medicine. The thyroiditis is the main reason for that. It is nothing but abnormal metabolism, which is a pitta rekta vriddhi, and along with that becomes the reason for this raised T4 and T3. Once the Shida and Shida Bija Dravya, Pitta Samana and Rekta Samana Dravyas are been advocated, the thyroid, the abnormal metabolism comes to the normalcy. That is Stambhana line, if you follow, that comes to the normalcy and reach to that reduced to the basal metabolic rate. And once that basal metabolic rate comes to the normal, gradually it's the body mechanism to control the normal, the raised hormonal levels. Now we will see some of the structural deformity. Female aged 60 years complains of severe difficulty in breathing, which is being increased on prolonged walking associated with difficulty in swallowing. Patient felt much difficulty in swallowing. He was not unable to. Sometimes he felt she was feeling much difficulty in breathing also, and severe lethargy, severe palpitation, anorexia, and everything were associated. And on examination, a non-tender hard swelling in anterior compartment of the neck. You can say this. Mushkavat lambade bahi. It's typically that word correlates in this condition. And on examination, lymphocytic thyroiditis. The diagnosis was chronic lymphocytic thyroiditis. What could be the line of treatment? And the T3, T4 and TSH were T3 were 98, T4 8.2 and TSH were 2. Again, here we have to follow a different approach. There is one famous quotation in Rasavaisheshikam, that is Chikilsayam Pradhanam Avasthanam Vidhanam. Depends upon the avastha, the condition of the patient, you have to shoot the medicine properly, because in such cases, especially in case of lymphocytic thyroiditis, in some stages, the patient exhibit the symptoms as hyperthyroidism, and we start the treatment as hyperthyroidism as per the Pitta Samana line. Suddenly, within a span of 2-3 weeks or 1 month, the condition turns to euthyroidism, normalcy, and she will be or he will be in the absolutely normal by biochemically. So what happens? Obviously, we stop the medicine immediately. The next stage is, when we stop the medicine, the next stage will be, again, it's not hyperthyroidism. She will go to hypothyroidism. This is the main sequence. This is the common sequence. It is followed, the stage-wise sequence followed in the chronic, especially in case of lymphocytic thyroiditis. So, how this case can be approached? Initially, in the first stage, we have to start with the Pitta Samana line, and the second stage we have to go for Kapha Samana line, and finally we have to end the treatment with the Kapha Samana along with the Rasayana. The main fact what we should do is, we should be aware, even though the parameters came to the normalcy, we should be aware that within a span of time she is going to face the hypothyroid phase. That condition that we should be aware, and by calculating that, or by taking in account that condition that we are not supposed to stop or regulate the medicines in between. Immediately, once the lab parameters came to the normalcy, that she came to the euthyroid state, that is the indication to start the Kapha Samana line and to start the treatment for hypothyroidism. So initially start with either with Pravalam or Swarnamakshi Basmam, or tablets like Legusuba Shegaram or Kamadugam. Even Abhraga Basmam can be given if she, what we say, if the breathlessness or breathing difficulty is more, if she is suffering from much dhadu kshaya, and if she is emaciated much, you can start Abhraga Basma, or you can give in combination with the Pravala Basmam and Abhraga Basmam, etc., or Swarnamakshi Basmam, etc. And initially, and other herbal group can like Drakshadi or Kalyanagam or Guluchiadi or what we say Shadangam, etc., can be considered in this stage. And once the symptoms of Pitta Vrutti Lakshanas has came to normal, and even the lab parameters also came to normal, then you have to shift the medicines to Kapasamana line. Again, entire line has to be changed. Again, you have to start with either Kasisam or Loham, and you can use Shilajit Bhasma, Kanmada Bhasma, or if the respiratory distress is still persist, you can go for either Talaga Bhasma or Chandamarudha Sindhura like medicines, or what we say other medicines which contain Gauri Bhashana, that is Chukundipalyadi or Swasanandam Guliga, etc. You can start in this stage. And Tankanam, which has got a Lekhana property, also has to be can be incorporated in this. If the Swasa symptoms are more and respiratory diseases are more, you can just you start either Swasa Kudhara Rasa or Surya Prabha or Vetumaran, depends upon the condition. If in the third stage, when the hypothyroidism also gets controlled, these are all happens. Definitely, this is not simple fluffing, and within a span of 2 to 3 weeks, the hypothyroidism also come to the normal. Here also, you are not supposed to stop the medicine. Definitely, you have to start this Rasayana therapy in this stage. That is a Kapasamana line, or Kapasamana and Rasayana you have to start. You can start with Swayamukti Sindhuram or Mandura Bhasmam or Magaradhvajam or Siddha Magaradhvajam, etc. You can start in this stage. So, in this case, I had followed Rasasinduram along with the Pravala Bhasmam with honey in the initial stage, and usually in the first 1 to 3 weeks, I had followed this Rasasinduram with and Pravala Bhasmam and Abhraga Bhasmam at 200 milligram at bedtime. And the next stage, the Pravala Bhasmam was replaced with the Talaga Bhasmam, that is Rasasinduram 125 milligram along with 50 milligram of Talaga Bhasmam, and the Anubanas were honey. In place of Abhraga Bhasmam, for getting more Chedana action, I started Annabhedi Sindhuram. And in the third stage, the medicines, the entire set were replaced with Magaradhvajam and Swasanandam. You can see the reports after a period of 3 months. That is, the above mentioned features suggest possibility of post-thyroiditis sequelae. That is, there were some amount of thyroiditis. Now only the scar tissue is being remained. So always this is quite possible, but the only main thing is you should be aware of the stage of the disease, and you should be especially what stage, what type of medicines has to be continued. That you have to be what we say fortunate. Now control the deranged hormone level. We will see, just summarize that. Hypothyroidism, hyperthyroidism, structural abnormalities and tumors. So these were the first one set. And the next step is control, how to control the comorbidity. There is a big group of comorbidities in this condition. The hormonal levels will be in the normal, but the comorbidities will be persisting. So what could be the line of approach in this condition? Let us see the 6-month-old male child presents with complaints of excessive dry skin on both upper arms and lower limb since 1 month, associated with complaints of frequent constipation, coarse cry, and poor appetite. These were the complaints presented by a child. What could be the line of approach here? 6 months old, see his age is simple for 6 months only. A 6 months old, if you just think that a 6 months old came to your clinic, the only complaint presented by him is nothing but simple dry skin. Do we have to suspect a thyroid here? Or another one, if the patient complained, if a 6 months old child, male or old child came to your clinic with a simple complaint of constipation, do we have to suspect a thyroid here? Definitely you need to. This was the condition. On examination, she or he will be presenting an abnormally protruded tongue and drooping of saliva. Sometimes this also becomes the presenting complaint. Sir, my baby is always opening the mouth and he is just showing his tongue abnormally, and always his saliva is being drooped off. This will be the condition. These are the conditions that you have to suspect hypothyroidism, and this is the main thing that you are never supposed to miss. Pediatric hypothyroidism, if you miss to diagnose pediatric hypothyroidism, definitely that child is going to suffer mental retardation within a span of his or her mental growth as well as physical growth is going to be in trouble. So always, if a patient a child patient, a pediatric patient come to your complaint with a dry skin, with abnormally protruded tongue, or with a chronic constipation, definitely you have to test for the thyroid hormone. So, and another thing is, as per my opinion, in this stage, better to refer the patient for hormone replacement therapy, because you are not. If something happened in between our treatment, if something happened, if the happened in between the treatment, or the real hormone level didn't get under control, 1 month or 2 months is enough to slow down his growth pattern. So always we are not supposed to pray. Excuse me. Okay. Yeah. Shall I continue? Okay. So we are not supposed to. Oh, okay. So we are not supposed to taking better not to play with the child growth pattern. And I will just explain once more. Okay. Maybe for dry skin, you can use a combination that is Sardodagrudam with the Yesadabasmam externally for external application. It's very effective not only in thyroid dry skin, all the other dry skin also. It's very effective because Yesadabasmam, you can just take little amount, maybe 100 milligram or 200 milligram Yesadabasmam. You can just take to your palm and just mix with little bit either Sardodagrudam or with the Mahadika Gridam or any of the Gridam, or maybe with creams like Eladi, or even simple coconut milk. You can just make a paste and you apply over there, and that moisturizes the skin. And Yeshadam is nothing but a zinc compound, and by making this mixture, you can just get a combination, an emulsion like what we say as a calamine lotion, lactocalamine lotion. So the abnormal dry skin will be relieved by the application, but better not to deal with the pediatric hypothyroidism. This is for hypothyroidism. This is what I believe. And and one more thing that you have to be taken care. Even maybe some other one more condition you might have faced. 1 month it may not be the age group may not be 6 months. The baby will be of 1 month old, or maybe some 3 weeks or 2 weeks old. As a part of their routine examination, the patient they might have diagnosed increased hypothyroidism, increased the TSH level. His TSH level will be around 10 or 15. So obviously the pediatrician might have told that better not to do anything in this stage. We don't have anything to do now. We will wait. We will wait for a period of 1 or 2 weeks, and then again definitely we will be rechecked. And then if still the problem persists, we will start the treatment. This will be the pediatrician's advice to that child. By hearing this one, the parents of that child gets confused, and they think, how can we leave this hypothyroidism or this much increased thyroid level without giving any treatment? So definitely they bring that child to us, and suddenly what we say, by seeing the abnormally increased thyroid level, TSH levels, we start our treatment, diagnosed as hypothyroidism or congenital hypothyroidism. We start our treatment. Within 1 week, the hormone level will be under control. This is another condition, within 1 week. But you are not supposed to go for this type of investigations. Why? Because always the first increased TSH was not actually hypothyroidism. Usually, structurally, when we analyze, the maternal oxytocin and thyroxine are structurally almost similar. Always they get interchanged in the analysis. So usually by doing the proper analysis in the initial stages, this oxytocin might have mimicked as thyroxine, and that lab person counted as this oxytocin as thyroxine, or means thyroid as TSH, and he might have written as increased TSH. But the pediatrician know that this theory, and this it can be maternal oxytocin, but there is no other test to differentiate whether it is oxytocin or thyroxine. The only one method is you have to wait for a period of 1 month, 1 week. If it is oxytocin, within a 1 week, automatically that comes to the normals. If it is thyroxine, definitely there will not be any change. So this theory, the pediatrician knows this theory, and that's why he asked to wait for a period of 1 week. And abnormally, sometimes we are not aware of this case, and we might have treated the same thing, and we got result also. We think that we got result. We started by thinking as this is hypothyroidism. After 1 week, we check it again. It might have reduced. Actually, we think that our treatment was success. So the same thing we start repeat in other patient also. If that condition happened to a typical hypothyroid patient, and she is going to be collapsed. But luckily, how we got result is it was not a fake thyroid, it's a mimic thyroid. It was an oxytocin. So that's why we got result. And the same protocol, if we try to follow in hypothyroidism, definitely we are going to fail, and that will end up in the collapse of that patient. And so better never follow. That's what I always insist. Better never approach in the condition. Please don't but we jump to a pitfall, and better not to approach handle the pediatric, especially the congenital hypothyroidism with our medicine. This is a sincere advice since my 15 years of practice, which I have observed. Another case, a female aged 60 complains of numbness and tingling sensation of lateral 3.5 fingers since 2 months. It was associated with mild pain. Sometimes these patients, these problems extend up to arm. On examination, wasting of thenar muscle. What could be the diagnosis? Definitely, lateral 3.5 fingers is the typical clue for diagnosing carpal tunnel syndrome. What we say, the wasting of thenar or hypothenar eminence also is a typical pointer towards carpal tunnel syndrome. But here also, if a patient approaches to you with a symptom of carpal tunnel syndrome, the next step that you have to do is you have to go for a thyroid TFT analysis, because carpal tunnel syndrome is the most commonest presentation of hypothyroidism. So in such cases, you have to, first you have to rule out the hypothyroidism. So we know that the deposition of mucopolysaccharide over the median nerve and tendons passing through the carpal tunnel. This is the reason for the carpal tunnel syndrome. Here also, the treatment for carpal tunnel syndrome as well as hypothyroidism becomes similar. And there, if the symptom of the patient, that is the carpal tunnel of the syndrome of the patient, is due to hypothyroidism, actually we are getting a lottery. That is, with single line of treatment, we can control both the disease. Usually in such cases, Vata Shamana protocol, especially the oil applications, oil dhara or Snigdha protocols or Amla protocol, Snigdha Amla Levana or Ushna protocol, Snigdha Amla Levana protocol will not be effective in such cases. Here also, we need to do Chedana, Lekhana and Kapha Shamana line of treatment. In most of the cases, when you apply the oils, you will feel anubhasaya. But at the same time, if you do a Ruksha Potali Sweda or Ruksha Lebana, there will be what we say relief also. See the it's a case of Kabhavrada Vada. Chaitya Gaurava Shulani, Katwa Dubashayo Brisham, Langana Ayasa Rukshošnam, Kamadasa Kabhavrade. It's a typical symptom of Kabhavrada Vada. And there the treatment is Kabhavrade, Yavanani, Jangalan, Mrgavakshinau. Yavam, what is the medicines like or which contains Yava? That is the Rukshashido, Sarovit, Vadagrit Yava. That's what I explained. So the treatment should be Kaphasamana, Chedana, Leghana, Ruksha, and Ushna. The medicines can be either Kasita Basmam or Shodhita Shilajit or Yasada Basmam internally, which also got the Chedana Leghana properties. And either otherwise, if she or he exhibits the treatment, the symptoms like excessive burning sensation or the Paithika Lakshanas, some of the Paithika Lakshanas, in place of Kasisa or Shilajit, you can go for Shodhita Gairiga. That also has got this Chedana Leghana action. The better anupanas are either Madhu or Nimbu Sursa or Purnava Sursa, depends upon the condition. In this case, the main thing, the whole line of treatment was either with Varanadi Kashayam, Kanchanara Ugulu, and Annabedi Sinduram. And definitely, you have to go for passive and active physiotherapy. Initially, start with passive physiotherapy and later followed by active physiotherapy. What could be the passive and active physiotherapy? Is there any reference for physiotherapy in Ayurveda? Have you ever came across in any of the context relation with Ayurveda and physiotherapy? Did physiotherapy explained in Ayurveda? Definitely, in Sushruta Samhita, Bhagna is the reference for that. Sushruta explained as Mritpindam Dharaye Purvam, Levanam Chatataparam, Haste Jadabale Chabi, Kuryat Pashana Dharanam. Initially, you start with Mritpinda, which is a little bit, what we say, soft. Mritpindam Dharaye Purvam. Once we get strength little more, improve, increase the what we say, strength of that pinda to the lavana. Pindam Dharaye Purvam. Next is Lavanam Jatataparam. Haste Jadabale Chabi. If when we get the proper strength to the palms, proceed to Kuryat Pashana Dharanam. Just go for the simple stone-like hard substances. This is the actually it's beyond the context, but still that is being explained in the text. And the same thing we have to follow here also. You have to start from the normal, simple physiotherapy to and to be processed to active physiotherapy. Otherwise, the wasting of the thenar and hypothenar eminence will be increased. Another case, male age 55 years, came with abnormal thickening of both palms and soles. The lesions were extremely dry and scaly in nature. It started 2 years back. And he, on examination, on interrogation, he revealed the history of hypothyroidism since 5 years. What is it called? What is it called? This is known as, maybe we may feel as psoriasis, but it is not psoriasis actually. The condition is known as palmoplantar keratoderma, which is a another cutaneous manifestation of hypothyroidism. Here also, we need proper hormone control. The treatment for what we say skin disease will not be effective in this condition. You can give local treatment intended to the skin. At the same time, you have to give internal medication to control this thyroid levels also. Varanadi Kwadam or Dhanandara Gridam, you can is a better option in this condition. Swayamagni Sinduram is a better option. And externally, as I explained, the mixture of Sadhauda Gridam with the Yastabasmam is very effective. As you can see the nature of this lesion is nothing but dry. Tojis Pudana Rukshada. Tatra Tojistide Kushte. Tojis Pudana Rukshada. It is the Togada Lakshana. Or otherwise, what we say, Pittam Tojistidam Guryat Vispodagam Asuriga. and almost all the conditions are simply as either Toggada Pitta or Toggada Vada. So Shadadauda Gardam with Yasada Basmam would be a better option in this condition. Next is female age 60 years, complaints of severe itching all over body since 1 year with a small hyperpigmented nodule over all over body. Sorry, hyperpigmented nodules all over body. Nodules in the sense it's very simple, prickly like nodules only. I will show you the picture. Pigmented hard nodules all over the body, more on trunk and lower leg. Patient become highly lethargic with gaining of weight since 1 year. See, it's a nodule, but we feel as dry skin only. What could be this condition? This also is a reason for the hypothyroidism is one reason for this. This condition I have explained in the initial 2 or 3 slides. You might have aware of that. Cutaneous lichen amyloidosis. Amyloids are protein deposits. Such amyloids are being deposited in between in the layers of the skin. Might have been deposited in the hair, the roots of hair follicle. If these amyloids are being deposited or what we say in the skin, it is known as cutaneous amyloidosis. If it is been, it